Bronx Borough President Ruben Diaz Jr. and the #Not62 Steering Committee presented a discussion of health disparities and COVID-19 in the Bronx, a virtual panel featuring Commissioner of Health Dr. Oxiris Barbot and healthcare professionals Dr. Jane Bedell, Dr. Lessie Branch, and Dr. Denise Nuñez. The panel was geared towards understanding the challenges to life and health in our communities and building resilience in the Bronx.
Moving forward, it's not enough to just say that we know the problem. Government at every level now have to give us the resources so that we can be better equipped. Should there second wave or third wave or maybe something else comparable to this unfortunately may come to us in the future.
Mr. President, I want to thank you for your commitment to ensuring that we don't remain #Not62, that we continue building on the work of communities and leverage what we're doing here in COVID-19 so that now and moving forward, we keep the health of Bronx center as we move this city forward.
The policies and practices of yesterday are determining the health outcomes of today.
Some of those practices being overcrowding, the amount of essential workers in our neighborhoods, underlying chronic disease, and policies such as redlining, an unethical, discriminatory practice denying mortgage loans and other services to whole neighborhoods on the basis of race or ethnicity.
Look at the Bronx Borough testing positive versus deaths, a little bit more evenly distributed, but still the Bronx having the overall highest rate of COVID-19 deaths. So all these things I mentioned before piling on and making COVID just a case study of how inequity that we live with today creates these problems that the spotlight is on. So to change the neighborhood health of tomorrow, we need to change the policies and practices today.
The disparate impact of COVID-19 correlated with race, socioeconomic status is indicative of the measure of systemic racism embedded in policy choices, right? And so policy choices are connected to socio-political dealings based on an economy that diminishes Black and brown transactions.
It hit us literally like from one day to the other, where we had to go from receiving, 2 or 3 patients a day to actually going and receiving 30 patients a day and changing the entire hospital at Montefiore, the children's hospital, into the adult hospital. So that took all of us, all of our efforts, plus getting help from the other floors, getting help from the residents, and putting the hospital in an entire ICU. The minority were the ones that were affected the most, right? We had the highest, one of the highest rate of infection and also the highest mortality.
The Bronx Borough President and the #Not62 partners will offer ongoing public outreach events and discussions like this one related to health in the Bronx, with upcoming discussions being food justice, building resilience, and health equity in contact tracing.
As a community, one conversation alone is not going to solve anything. So I'm hoping that we get a lot of feedback. We're hoping that people will then chime in the next time so we can address some of the topics. For those of you out there, even though we know that the numbers are low, practice social distancing. Wash your hands, use hand sanitizer, and use your mask.
To view the full health disparities in COVID-19 in the Bronx panel and future discussions, please tune into your BronxNet channels on 67 Optimum, 2133 Files HD, and you can also tune in anytime online at bronxnet.org/watch. Just click Bronx Currents. Reporting for BronxNet, Sonyi Lopez.